Hi, and welcome to Emory University's Orthopedic Physical Therapy Residency course for 2023 on the knee. My name is Lita McDaniel. I'm a physical therapist in Atlanta and an adjunct professor at Emory University, and I will be the instructor for our course. So learning objectives for this course, we want to briefly review and identify pertinent anatomy and biomechanics of the knee joint. We want to briefly review causes of knee pain, so differential diagnosis as relates to physical therapy and primarily orthopedic diagnoses, but also some screening. We want to discuss and practice physical therapy subjective and objective testing for the knee. And then we want to kind of deep dive beyond what you probably already have gotten in your physical therapy training so that we can raise the level of clinical decision-making and understanding as an orthopedic resident. So we want to really focus on what our best practices in orthopedics for physical therapy. Part of that is going to be to identify and practice items, including diagnostic items and treatment rationale and prescription that are recommended from our most up-to-date orthopedic clinical practice guidelines or CPGs regarding the knee, and also utilize clinical prediction rules or CPRs that have been studied, again, within physical therapy orthopedics for knee pain. And we want to give you a chance to practice your clinical decision-making with practice cases as relates to management of knee pathology, knee pain, so both surgical and non-surgical cases, and we'll do that towards the end of the course. So just a little roadmap and a course outline. This course is broken up into two different styles of learning or ways that we can present some of the information. So it consists of 3 separate pre-recorded lectures that are going to be your responsibility to listen to and write down any questions that you might have from, and those are going to encompass the anatomy and biomechanics portion, and then brief presentation of what we are thinking about including in the subjective examination for the knee and the objective examination for the knee as orthopedic clinical specialists in physical therapy. And then the fun part is we get to meet in person and we get to really practice using some of these skills instead of talking about them so much in application to case studies. So treatment considerations and skills practice. So 5 separate PowerPoint presentations, 3 recorded, 2 will be in person. Majority of our in-person session will be spent practicing hands-on skills as well as talking through separate case studies that will try to highlight these different aspects of knee pain and management within physical therapy. I will present a little bit on treatment considerations because you won't get that within your pre-recorded content. I felt like that was best left to our in-person session. Also, want you to be aware of some important documents that help support the information that I'm presenting. These key study documents are the current concepts for the knee from the Academy of Orthopedics for the APTA, as well as a post-op monograph. I'm utilizing the 5th edition, which is the most recent current concepts. And so that should be the most up-to-date information that we have from that orthopedic section. We also have 5 separate CPGs for the knee. And so I will be leaning on those heavily as we talk about different or diagnoses that those apply to. And then we also have some clinical prediction rules for the knee, both for diagnosis and treatment. So you can kind of think of this as your checklist or as your cheat sheet for these guiding documents that we have within orthopedic physical therapy diagnosis and treatment, so management of patients with knee pain. These are some symbols that I've created that you will see interspersed within the PowerPoints. So the yellow graphic is going to be for CPRs. So anytime you see that, that will be describing one of our clinical prediction rules. The orange is for our CPGs, the clinical practice guidelines. This gray box is orthopedic clinical pearls. Those are what I find that are maybe higher level decision making or nuanced information that we can apply and really contribute to some of your higher level skills as an orthopedic specialist. And then this blue symbol relates to our skills practice. So those will be our hands-on techniques that we want to talk about and practice with our in-person session. So thank you very much for having me. I really look forward to meeting you in person. If you have any questions as you're going through the recorded lectures, or absolutely in person, we can discuss some of your questions. And after the fact, I would love to hear from you. Here's my contact information. And I really am looking forward to being with you for this content and for this course. So thank you so much.